So what is the scope of practice of Ayurveda in the USA at the time of filming this video in 2024? So I'll give you a little bit of a appreciation of how Ayurveda has kind of evolved here in this country, and where we are in its development and in it taking root. So Ayurveda was first introduced to the West back in the 1970s, so really not that long ago. Maharishi Mahesh Yogi, coming from India, who started the Maharishi Institute in Fairfield, Iowa, is credited as being one of the first people to bring Ayurveda here in the West. One of his most famous disciples, who all of you know, is Deepak Chopra, who has started kind of the mind-body movement in his own way. He wasn't always using the word Ayurveda to spread that wisdom in the beginning, but now he's really kind of embraced talking about Ayurveda as it's really grown and started to flourish. My teacher, who I trained with, Dr. Vasant Lad, started really one of the first schools in the country back in 1984 in Albuquerque, New Mexico. So it continues to be the oldest school for Ayurveda in the country, and has done a tremendous job at spreading the word of wisdom of Ayurveda, and Dr. Lad's students have really spread their wings all over the US, but also throughout the globe, starting their own Ayurvedic centers and schools in other countries and other continents, which has been exciting to see that growth. So Dr. Vasant Lad, who is my mentor and my guru, I trained with him for 4 years in New Mexico. I also went to the sister school that he created in India to do additional clinical training over there. But he is someone that really has been a pioneer for not just bringing Ayurveda here to the West, but really creating the systems and structures in place for that to grow and flourish. I've had many of my own students or patients who've been inspired by Ayurveda go to visit his center to be able to study more or to participate in workshops and classes. So just as of 2022, the center and school were relocated from New Mexico to North Carolina, and it continues to be a wonderful resource for spreading and sharing Ayurveda there. So you might be asking, how are people in the US trained to become Ayurvedic practitioners? And before I share that, I'll share about our national organization, NAMA, which stands for the National Ayurvedic Medical Association. This was created back in 1998 while I was still a student, and I've been able to watch NAMA's growth over the years as they become a bigger organization, an umbrella for many other Ayurvedic practitioners who are flourishing and developing. And so what NAMA really did is first start to work on accreditation standards of education for the number of Ayurvedic schools that were starting to be created. We needed some type of standards of education. And so that has been standardized into about 3 years of education. Not every Ayurveda school offers 3 years. They might only offer a first-year program or maybe 2 years, but more and more schools are growing to accommodate a bigger curriculum and create a 3-year certification program. So once you've gone through those educational standards, that NAMA has continued to work with the Ayurvedic schools in the country to meet those standards. And then the next thing they did is to start to create different tiers for students graduating from these schools to define their scope of practice and reflect their number of years in training. So there are 4 categories that NAMA has created. So the first level category is to become an Ayurvedic health coach, and you can do this with 1 year of Ayurvedic education. So the number of Ayurvedic coaches is growing. Some people might specialize in maybe nutrition or a specific disease condition that they want to focus on. But the Ayurvedic coaches are basically educated to be able to give lifestyle advice and guidance and dietary or nutrition guidance to their patients. The next tier up from the Ayurvedic health coach is an Ayurvedic practitioner. So this is someone who has 2 years of Ayurvedic education. And this is someone who can do more than just diet and lifestyle counseling, but they can start to prescribe herbs. They can start to diagnose a little bit more and offer more guidance and support for patients. Volume-wise, probably Ayurvedic practitioners is growing to be more now than the Ayurvedic health coach. I don't have exact numbers of how many people are getting designated into these titles. We're still a small but growing field. And then the third category Nama created is the Ayurvedic doctor. So the Ayurvedic doctor is someone who's had 3 years of Ayurvedic training and education here in the US. And once they have that, they can call themselves a doctor, but to say that this is a NAMA certified designation, so not equivalent to an MD. It's also not equivalent to a Ayurvedic doctor from India. So that's kind of the fourth category, is Ayurvedic doctors from India are trained with a standard of 5 years of medical school education, and they get a BAMS degree, a Bachelor of Ayurvedic Medical Science. So for someone like myself, who's an Ayurvedic doctor trained here in the US, even though I did 4 years of training, this is before the schools had any type of accreditation to it. So my level of training is still not equivalent to an Ayurvedic trained doctor in India or a BAMS doctor. So those are the 4 tiers that NAMA recognizes, so people can differentiate their level of education, their level of training. There's also 2 other categories that have been created. One is for an Ayurvedic body worker. So there are many people who just get trained in Ayurvedic massage. They might just do 1 year of training, but they don't want to go into coaching patients. They just want to do the hands-on body work. So there is a designation of an Ayurvedic body work therapist. And the other one is an Ayurvedic trained yoga therapist. So I'm also an Ayurvedic trained yoga therapist is one of my titles. And so what it means is that we're really using yoga therapy as a form of medicine where we can work with patients one-on-one, coming in with specific injuries or specific ailments, and we know how to write a yoga prescription, and we know how to coach that patient, teach that patient how to use specific yoga practices, breathing, meditation techniques, yoga poses to help overcome their insomnia or their anxiety or whatever their issue might be. So those are all of kind of the designations that we're seeing with Ayurvedic practitioners in this country, and all of the different tiers and labels that we might give them. So when I have patients who are looking for Ayurvedic guidance, maybe they're moving to a new part of the country, they want to find some Ayurvedic support there. So I'm very careful to explain to them the difference between these different labels so that they can get an understanding of that. As far as working towards licensure, this is a goal in the Ayurvedic community. We're still at the beginning stages of this, so there are no states in this country currently in 2024 that license Ayurveda, but there is a movement growing for how can we do this. And so the first steps in order to do this were to create the standards of education. The next steps were to create these different tiers for people who are practicing Ayurveda, to give us some different designations. And so the next step after this is to increase our volume, increase our members, get the right lobbyists and support for this to happen. So there's a couple states that are taking the lead with this. California, Colorado, that have a high volume of Ayurvedic practitioners, and also Florida is starting to look into this, where we can start to increase our scope, where we can become licensed eventually and be on the same footing as other integrative health modalities such as acupuncture, who went through this process back in the 1970s and 80s, and we saw licensure start to happen on a state-by-state basis. So this is the future direction where Ayurveda is going to be able to get that recognition. So if you are looking to add Ayurveda into your clinic and possibly hire someone with an Ayurvedic background, you want to make sure that they're NAMA certified. There are exams now to become an Ayurvedic health coach, an Ayurvedic practitioner, and an Ayurvedic doctor. So there is, steps that they need to follow to get those designations. And so you just want to be careful when you are hiring to see what is someone's level of knowledge, their skill set, their certification status, to be able to see how can you best integrate them into your clinic. Having an Ayurvedic health coach is an excellent way to go if you want to give diet and lifestyle guidance and support to your patients. If you want to bring someone who can integrate with your specialty better and maybe has herbal knowledge and has experience working with the type of diagnoses that you see in your specialty, having an Ayurvedic practitioner might be a good way to integrate that. And then having an Ayurvedic doctor, of course, someone who has more experience, or a BAMS Ayurvedic doctor trained from India is a wonderful integration into your practice to just bring someone who's really skilled and reputable who can offer those services to your patients and to your clientele. So that's a very quick overview of the history of Ayurveda in the US and kind of the future direction of where we might be going as this modality continues to grow.